Hi, it's Dr. Fawad Mian. Today we're going to talk about how to get rid of knee pain. How to get rid of knee pain as soon as possible. What's causing my knee pain? And will my knee pain really ever go away? The biggest treatment that's used to get rid of knee pain, which is all over the internet, as you've probably looked at, is RICE, which is rest, ice, compression, and elevation. While this may be helpful for more of an acute injury, for more long-term issues with your knee, it's not really going to be helpful in terms of getting your knee better overall in the long run. It's just more of a short-term fix. So resting certainly can help if you stay off your leg, your knee for a few days, and it might get better on its own. And then sometimes we'll elevate our knee or our leg when we see that there's swelling in our knee. We may put some ice around it with an ice pack. Sometimes we'll take some anti-inflammatory medications like ibuprofen, Aleve, and Tylenol just to try to help with the pain. But inevitably, these are more short-term treatments, and they may not really fix more of the long-term issues that are going on. And so, when we talk about common causes of knee pain, one common cause is arthritis. So typically, RICE over a long period of time is not really going to fix this issue. You're going to have the recurrent knee pain over and over and over again. So you may really have to look at better alternatives to try to help with that knee pain, whether it be physical therapy or some other type of treatment, whether supplements, or injections, so forth, or even potentially some other pain-related treatments too as well. When we talk about how to get rid of knee pain as soon as possible, sometimes, again, it can go back to doing some of the RICE stuff that you may see on the internet, but that, again, is more for acute injuries. One treatment that is commonly done, unfortunately, is actually getting steroid injections within the knee. And while that may give you some temporary relief, maybe for a couple of days, sometimes for a few weeks for some people, it doesn't fix the underlying issue. In fact, it actually makes the problem worse because it actually damages bone, ligament, and tendon over time. So it's not something that you really want to have injected inside your joints, particularly your knee joint, because you're just accelerating damage, which is going to get you closer to that knee replacement and having a surgery of some sort that you don't necessarily need. There are also the gel injections that are sometimes used, and that can sometimes take a few weeks for that to help to a certain extent. That in and of itself doesn't heal or make anything better in the long run either. I kind of liken it to like WD-40 into your joints. Gives you some relief, and sometimes that relief can last 6 months to a year, sometimes only a few months as well. Sometimes may not be helpful at all. But these are some of the more common things to try to get you out of knee pain quicker. Physical therapy also is something that can be helpful, especially in some of the acute stages. Sometimes it does take a little bit of time for that to help as well. You may also ask, well, what's causing my knee pain? And sometimes that can be a complex answer because it can be ligaments that are damaged, such as your ACL or your MCL, your PCL or your LCL. These are all ligaments that are surrounding your knee. It can be cartilage. Your medial or lateral meniscus, for instance, can be damaged. Can also be patellofemoral syndrome, which is pain in front of the knee when there's a malalignment or there's damage around the knee from either injuries or overuse are common examples. Arthritis, as we also mentioned too as well. These are some of the more common things that people can have, but people also can have knee pain because of medications that they take. Could also be from gout or rheumatoid arthritis, which are more systemic issues that people have. When we talk about whether or not knee pain will go away on its own, a lot of times it may simply go away on its own. So sometimes just resting it for a few days may be just good enough for you. Physical therapy, as I mentioned before, sometimes can also be really helpful because you're strengthening the muscles around your knee, and that's going to give it the most amount of support. So supporting your knee with your muscles and getting them stronger are going to be helpful in the long run. So sometimes that may be some weights that you may utilize. Sometimes it may be some other leg strengthening exercises. It might be more a formal physical therapy program that you might do as well. Sometimes acupuncture can be a helpful adjunctive to something like this as well. Supplementation with anti-inflammatory supplements. Common examples are glucosamine, chondroitin with MSM. Can also be turmeric, can be fish oil. Having good quality, potent supplements can be helpful in the long run in terms of making knee pain go away, especially when it tends to be more of a chronic thing. Things that I would avoid essentially would be steroids for sure. A lot of times you don't necessarily need to have surgery unless you're really having severe issues. There are also other alternative treatments as well, which we do in our office, such as platelet-rich plasma and autologous cellular therapy too as well. And these are more topics that I can talk about more in detail later on. But hopefully you find this video helpful. Please like or share this video if you found it helpful with family members, friends, or any loved ones. And until then, we'll see you soon.